Onto Victoria, onto Melbourne. Is it in control, this outbreak?
Well, Pete, what we can say, of course, is that the measures that the Victorian government and the public health officials down there that have put in have been really unprecedented. I mean, going door to door at local government areas, communicating there with the households and the communities that are most at risk to get this under control. They turned around that program very quickly. It's ongoing. This is also the state that conducted 160,000 tests in 2 weeks. So I don't doubt their capacity to bring this under control. We do need to wait and see what the numbers over the next couple of days show us, because the combination of testing, of contact tracing and putting people into quarantine and isolation, that the results of that will be apparent in the next week.
But currently it is out of control, is that what you're saying?
Not at all, not at all. I mean, I think out of control would imply large numbers of people sitting in hospital around Australia. There's only 11 and one in an intensive care unit. I think that the numbers have been slowly and modestly increasing, as you might expect. But a lot of those cases, in fact, the vast majority are linked to known outbreaks in Victoria. So the cases of community transmission where there are no links at all, which would be of concern, remain in the very small minority of those cases.
Is it a second wave?
Well, the term second wave is not actually a public health term. It's come in sort of common parlance over the past couple of months. I think second wave is something that happens across an entire country, something that happens across the entire world. Of course, the world is in its first wave, not its second wave.
Yeah.
If you look at the epidemiological curve at the moment, it's better described as a second peak in Victoria's cases that's created by several geographic outbreaks. That's being a little bit technical, but that's what it is.
OK. The saliva test, Doctor, how accurate is it?
The important thing about the saliva test is the process that the saliva goes through in the laboratory is exactly the same as the nasal and the throat swab. There is a marginal, perhaps a slightly less accuracy compared to the throat and nose swab, but ultimately if you had a choice between not doing the test at all because someone had said no to a throat swab and doing a saliva test, then the saliva test is a preferable option. To make sure that accuracy is maintained, the Doherty Institute and the Victorian Public Health Labs, they've already conducted good validation studies on the saliva test, and they're continuing to do that as the saliva tests roll out. This is a world first down in Victoria, and it's going to help a lot of people like children who sometimes can't have the tests to get the PCR coronavirus test done.
So, I mean, I haven't had a test yet. I haven't needed to. But what are the grounds for refusal? I mean, does it hurt? I mean, and are you surprised at the amount of people who are refusing it?
No, I'm not surprised at that, Peter. It's look, I've had it twice. It's not particularly pleasant whilst the test is going on, but it only lasts for about 10 seconds or so, and it's uncomfortable rather than painful. The saliva test obviously offers another option now for those people who might be concerned. It's still our preference, and the gold standard test remains the nasal swab and the throat swab.
I just want to get, just before you go, Doctor, the app. A lot of people talking about the app now. A lot more critics are coming forward to saying it is simply not working. Is it working?
It's absolutely working. The COVID Safe app is working. It has worked to identify a contact that wasn't otherwise identified by contact tracers down in Victoria. Subsequent investigation revealed that wasn't a significant contact, but it does demonstrate that the app itself is working. It's in the workflow of the Victorian public health units. They're using it now. So the app is 100% working, and it will work even better the more people that download it. 6.5, I think we're pushing 6.5 million, which is over the target of 40% of the mobile phone using population. The more people that download it, the better. It's an excellent adjunct and augments the capacity of our disease detectives. We still encourage people who haven't downloaded it to get it on their phone.
I mean, I guess the criticism comes from numbers that are very low, that are attached to the phone. So, I mean, does it work when your phone is locked? Can it talk? Can the system talk to Apple phones and other companies as well, other manufacturers?
Yes, it can. We're aware that there have been issues early on with the iPhone to iPhone and the Android to iPhone communications. They're constantly being worked on. They're constantly being improved. The important thing is that the app is generating data. So if your phone's got the app running and it interacts with someone else's phone with the app running, it is generating contact data. It's doing it as we speak. So it's functioning as intended. And of course, the Digital Transformation Authority will continue to make improvements on the platform, but it was working from day one when it was released on April 26th.